Hi, welcome to St. Francis Medical Center College of Nursing. We're delighted to have you. I would like to start this orientation by introducing myself. I'm Dr. Kim Mitchell, Dean of the Graduate Program. I'd also like to start with a quote from Nelson Mandela. He says, "Education is the most powerful weapon which you can use to change the world." And that's why we're here, to be able to change the world, make things better for our patients. Our motto is excellence in education, and we've been educating nursing students for 110 years. We believe that your success is our success, and we're going to do everything we can to help you be successful. We are accredited by both of our MSN and DNP programs by CCNE, which stands for Commission on Collegiate Nursing Education, and the Higher Learning Commission. Our certification pass rates are very high, and we have a very high employment rate of our graduates. You've made a good choice in choosing this school. We work on continuous quality improvement, so if you get a survey from us, we hope that you will fill it out. If there's a problem and we don't know about it, we can't fix it, so we really like your feedback. Watch for messages from your student reps. We have one for the master's program and one for the doctoral program. And they'll be asking you prior to our graduate program meetings if you have any concerns or if there's anything you would like to bring forward to us. We have a talented group of faculty here. Most are doctorally prepared, but all are very clinically sound. They hail from schools such as St. Louis University, Illinois State University, and the University of Northern Colorado, among others. You have many resources here, and one of the most valuable resources is your academic advisor. We recommend that you see him or her at least once a semester and more often as necessary. And when I say see, that doesn't really mean that you have to come into the college for a visit. It does mean that you should talk to them by phone, email, or video conferencing. Any of those methodologies are great. Please be sure to communicate if your circumstances change. For example, you need to take a leave of absence, an incomplete, or withdraw from a class. If you do need to drop a class, try to do it within the first week during the summer session and within the first 2 weeks of the fall or spring session when you can get 100% refund. We have some other valuable resources such as our librarians. They are very talented and they can help you find articles you may be struggling to find or get articles that we don't have on site here but that we can get through our Library Alliance. We have a writing lab to help you if you're struggling with your writing and if you're having trouble with the APA format. Some expectations: you can expect that you will be needing about 2 to 3 hours per credit hour outside of class in preparation for class, such as your readings, writing your posts for your threaded discussions, and things like that. Organization is key to your success. Making sure that you know when your quizzes, tests, projects, papers are due, and getting those on your calendar are very valuable so that you can plan ahead. This is a great time to say no if there's a particular organization that wants you to help with something. It's advisable to say that you would be happy to help once you finish with your degree, but try to keep your outside responsibilities to a minimum. If you need to take a vacation, of course you need to take a vacation, but plan it outside of the semester if you possibly can. If you do need to take it within the semester, please contact the faculty member so that you can work ahead on assignments or get an extension. And if you need an extension, even if you're not going to be on vacation, faculty are typically very generous with extensions. Just let them know before the assignment is due that you need the extension. Attendance at class is very important. So sometimes you'll have video conferencing classes, and you'll need to know when and where those are going to be, when, what time and day of the week and time. And then if it's a threaded discussion, you need to know when the first post is due and when you have to have all of your posts completed by. We have guidelines for your computer so that you have good computer reception and don't have any problems. So if you do have problems though, we have a computer coordinator, Jeff Kepler, and we also have access for help through Canvas at the 1-800 number, and both are extremely helpful to you. We have the student handbook online at sfmccon.edu. But if you'd like a paper copy, just let us know and we will get one to you. Lots of resources are available online at that website. The mission at St. Francis Medical Center is to serve with the greatest care and love, and we pull that philosophy over here too, so that we are serving you as a student with the greatest care and love. This is a Catholic school, and we have Catholic roots, deep Catholic roots. We follow the ethical and religious directives of the Catholic Church, as well as the ANA Code of Ethics. One of our commitments is to improve the health of our communities. And I'm going to read our philosophy. Our philosophy is that the purpose of nursing education is to promote a student-centered learning environment that develops critical thinking, skills of inquiry, creative thinking, and problem solving, and the process to obtain knowledge. And I think you'll find that you do a lot of learning by discovery. And we know that the things that we remember most are the things that we learned on our own. Some things related to the Catholic Church that I want to let you know about is we do not promote euthanasia, abortions, the use of birth control, including condoms. Some specific information from the handbook that I want to point out. One is that you need to have at least a B in the course in order to pass, and a B requires at least an 85%. We don't round, so you need to have the minimum of an 85% to pass the course. If you would need to withdraw from a course, there's a special form that you need to fill out, and you can get that from Vicki Craig. There's an expectation of a time frame with which you will finish the program, and that is within 1.5 times of the normal length of the program. And so for the master's program, most of you will be finished well within the 5 to 6 years that you have to finish the coursework. And for the DNP program, BSN to DNP, that's 9 years. So usually you have plenty of time. But if life happens and you're running into concerns about the deadline, just talk to your academic advisor. We can bring this concern to the graduate committee, and almost always they approve these extensions. If you need a leave of absence, there's a form that you need to fill out so that we know when to expect you when you're coming back. And if you would need to take it incomplete, that's not a problem. You just need to have 75% of the work done. You need to complete a form, and it's advisable to talk to your academic advisor. Academic integrity is very important, and one of the top concerns is plagiarism. Plagiarism is the use of someone else's ideas or words as if they are your own. So it's not enough to just change a few words around and then act as if it's yours. Okay, we need to give credit to the people who have come up with these ideas. If you use their words, use direct quotes and a page number, and that's how you say to others who are reading your work that this is somebody else's idea that you thought was very good. Avoid copying and pasting information from websites. This is a common thing that students do, but we want to caution you against this because that's a type of plagiarism. What we're asking you to do is take those words and put them into your own words and share them with your peers. It's advisable to record your sources of information right away so that you remember what they are. It's easy for these things to get lost if you don't write them down immediately. If you use direct quotes, put the quotation marks in and the page number where you got the information. I want to talk a little bit about online etiquette. One thing you sometimes see is if people use all capital letters. That's as if you are yelling. So you want to be sure you are using uppercase and lowercase letters in your writing. Avoid using language that you could use in a text message, LOL, for example. We're going to use professional terminology here in this professional environment. I extended caution in using humor in your written work because without the facial and the voice messages, it's hard to interpret the humor. Be sure to proofread your work before you share it with others. When you're sending email messages, be sure that they're professional messages, that you have a professional subject line and a professional greeting. So for example, hey is not an appropriate professional subject line or greeting. Be sure to always sign your emails so that we know who the message is coming from. If you're moving, be sure to let us know, moving to a different state. Some states do not allow us to educate students from their state, so we would want you to know that well in advance so that you can make accommodations. Professional conduct is very important, and one of those things is confidentiality. So be sure to keep patient information confidential, and I would like to talk a little bit about HIPAA, and that means that you can only get information from the electronic medical record for patients that you are seeing and not others, including yourself or family members. Professional dress is important, and the student handbook has some guidelines for professional dress, but when in Rome, do as the Romans. So what I mean by this is, if your preceptor is wearing dress pants and a shirt covered by a lab coat, that's probably appropriate dress for you to wear in that setting. Communication is very important. So if you need something from your faculty member, for example, help on reviewing a test, or you have questions about an assignment or anything else, be sure to talk to your faculty member first. Remember, your success is our success, so we want to help you. I'm here if you have any concerns that have not been addressed appropriately by others. I'm more than happy to talk to you about any concerns that you have. So that's all I have. Let's go out and change the world for the better. Thank you, and have a great semester.